Morning, everyone. Is everybody ready to go? Morning, everyone. My name's Itrat Ali, and I'll be chairing the meeting today. Welcome to the Children's Scrutiny panel. It's Friday, the 17th of October at 10:30. So, to start with, we'll do a quick round of introductions. So, if we start with panel members in the room, we've got. Can I remind you all as well to use your mics?
Hi, I'm Hannah McKirker, I'm ward member for Denby Dale.
Hello, I'm Joanne Sanders. I'm Service Director for Learning and Early Support.
Hi, I'm Tom Brailsford. I'm the Director for Children's Services for Kirklees.
Hi everybody, I'm Ian Bennett. I'm the Director of Nursing and Quality for Kirklees and Calderdale for West Yorkshire ICB.
Go.
Hi there, I'm Rob Fordyce, Children's Principal Social Worker here for Vicky Metheringham.
Hi, I'm Dawn Pitt. I'm from PCAN, the Parent Carer Forum for Kirklees.
Hello, I'm Joanna Hull from PCAN also.
Morning everyone, I'm Stuart Horn, I'm the Head of Children's Commissioning for West Yorkshire ICB in Kirklees and Kirklees Council.
Adrian Wisniewski and I'm SEND Programme Manager.
Good morning, I'm Councillor Jane Ryler, Cabinet Member responsible for education.
Good morning, Helen Kilroy, Assistant Democracy Manager from the Governance Team. Morning.
Welcome everybody in the room. We have actually got attendees on Teams as well. So if I can hand over Councillor Kendrick, if you want to introduce yourselves.
Good morning, I'm Councillor Viv Kendrick. I'm the lead member for Children and Young People Services.
Councillor Smith.
Thanks, I'm Richard Smith. I'm the Shadow Cabinet Member for Children's Services.
Vicky Dutchburn.
Good morning, I'm Vicky Dutchburn. I'm the Accountable Officer for Kirklees ICB and the Place Lead for Kirklees.
And we've got Adrian Wisniewski. Is it? For that. So welcome everybody. We've got apologies from Councillor Bramwell, who will not be able to join today. So moving on to item number 2, which is minutes of the previous meeting. So I propose, we've actually got 2 sets of minutes from the 8th and the 29th of August. I propose this. Do we have a seconder?
Yes, seconded.
Thank you, Hannah. Any declarations of interests to declare? None? Item number 4, so just to remind you that this all agenda items will take place in public. Item number 5, deputations and petitions, so none have been received. Whiz through to item number 6, public question times. Again, no questions were received. So we move on to item number 7, which is the outcome of the Kirklees Local Area Partnership Inspection of Send and Alternative Provision undertaken in June 2025 by Ofsted and CQC and the Post-Inspection Action Plan. So I will hand over to Joe and to Ian.
Yes, that's right. Thank you. So thank you very much for inviting us to today's meeting so that we can give you an update following our SEND inspection and the plans that we have put in place as a result of that. And I just would like to say the real strength of the SEND inspection is our partnership arrangements, and you'll see on the first slide that's up there around our health partners, our local authority partners, our education partners, and most importantly, the voice of our children and young people through the networks and relationships that we've got. we really couldn't achieve what we've achieved with our inspection outcome without those strong partnership and relationships that we've got. And what we're going to do is talk you through the output of the inspection that took place, but also our areas of improvement. So just some background and context around the SEND inspection. So all local area partnerships are eligible for inspections, which is undertaken by Ofsted and by CQC, and look specifically at children and young people with special educational needs and those with disabilities, and is referred to as SEND, and also includes looking at alternative provision. The Kirklees Local Area Partnership was inspected between the 16th and the 20th of June in 2025, and the report was published in August. For awareness, the last inspection that took place was in February 2022, and that there were 2 areas for improvement and written statements of action that were included within that, and I'm pleased to be able to report that the continuous work and significant improvement that has been made since the last visit on those 2 areas have meant that we haven't sat on our laurels and we've continued to progress. So in terms of the outcome of the inspection, the report said that the local area partnership arrangements led to inconsistent experiences and outcomes for children, young people and those with special educational needs and disabilities, and that the partnership needs to work much more jointly to make improvements. Ofsted and CQC asked that the local area partnership update and publish its strategic plan, hence why we're here today, in order to look at the recommendations and set out within as they've been set out within the report, and also to share the detail of what we're going to do. You'll hear us refer to this as the big plan part 3, which is what we're going to do, and along with my colleagues today, we're going to give you an update on what that means for us as part of the rest of the presentation, and we've got some time at the end for any questions and comments as well. I'm going to hand over to Tom now.
Thanks, Ian. Thanks, Chair. So just a couple of things before I start. So in terms of the outcome, as Ian said, the outcome was that children and young people have inconsistent experiences. So I'll just remind panel members of the possible outcomes. So the 3 possible outcomes are that children and young people have good experiences, children and young people have inconsistent experiences, or that there's widespread systemic failures. So we got the middle judgment, which is what about 56% of local authorities nationally get. So I think it's worth just putting that in context. So I think it's also worth saying that we felt that the inspection went really well in terms of the communication with inspectors. The lead inspector from Ofsted and CQC worked very closely with myself and Ian, and we had a very transparent and open dialogue from the start, really. I think it's fair to say. So overall, it was a good, our inspection was a good experience, and we fed that back to the DFE and NHS England. So what did the inspectors say that we were doing well? One of the things that was really nice to hear is the recognition of how ambitious we all are as leaders for our children and young people with SEND. They were very clear, although they didn't write it in the report because there's a format to that, how impressed they were about how child-centred we were, but how ambitious we were, which was really nice to hear reflected back to us. They were also really clear that we co-produce things well, that we work really well with our parent carer forum and with children and young people. And co-production is throughout the partnership. That's not just the council, that's not just the ICB, that's schools as well. They were really clear that we knew ourselves. So if you remember, we had to do what you call a self-assessment, where we looked at every single area that falls under the framework in Kirklees. And there was nothing that they told us that we didn't already know or that we didn't have an action plan in place for. So, knowing yourselves is really important as a partnership. They saw passion and dedication in our staff, which I think, again, is really important to us. Obviously, they didn't just speak to senior leaders, they spoke to occupational therapists, they spoke to CAMS workers, they spoke to schools, they spoke to a variety of people, and they saw a great amount of passion and dedication, which is really good. Very positive about our big plan. You know, we've brought it a few times, haven't we? We've had big plan 1, big plan 2, and now this is big plan 3 in terms of the way we've co-produced that with families and children and young people and how user-friendly that is. And actually, as I've said before, they were really clear that we're putting children at the heart of our decision-making, and we're listening to children and young people and families' voice, which is really evident in a lot of the work that we're doing, particularly the way we've co-produced our special schools. And we just had the groundbreaking ceremony a couple of weeks ago up at what's going to be the Joseph Norton site at Deaton, which was really positive. Okay, so what did the inspection tell us we needed to focus on? As I said, these were probably the areas we would have said we needed to focus on. So there's that preparation for adulthood bit, which actually isn't just about transitions at later stages in life. That's about preparing for adulthood, in our view, from the earliest possible opportunity. It's about how we encourage independence, but it's also about those transition points across the system and how we work better with adults in terms of across adult social care, but also adult health provision. So we've got some actions around that. We know that waiting times for some health services are too long, but actually, if you put that in the context of the national waiting times picture, we aren't out of kilter in a lot of those areas, but however, we still recognise we want our children and young people to have access to health services as soon as possible. Our education, health and social care plans, on the whole, I think, you know, there were lots of positives when they looked at our plans and looked at the case studies, but what was clear is there wasn't always information in there from a health and social care point of view to the level that we'd want it to be there. So, you know, some of those plans are inconsistent. Again, we knew that because we'd been auditing our plans, Ian, myself, Joe and other senior leaders, as well as our staff, so we were well aware of what the shortcomings in some of our plans were. And then finally, they said to us we needed to look at communication, which again, I think we would all concede could do with some improvement in some areas, although it has been improving for some time. But actually, the way we communicate as a system, we need to make some improvements about that. So fundamentally, those were the things that they found. As I've said, the approach, as we've done before, has been about the big plan. So when we've produced this action plan, we've done it in the same way, because it's not a separate thing for us. It's part of all the improvements that we want to make anyway. So we can read that document on its own as a response to the inspection, but also it complements all the other parts of the big plan. And again, we've used what children, young people, parents and carers have already told us to work with it. There's also a detailed action plan that's in its very late stages of being finished, that sits underneath this plan, which again we're co-producing across the partnership. So just to take you through some of the detail in the areas, Joe will do that for preparing for adulthood, and then we'll move on.
Thank you, Tom. Yeah, so I think a lot of the areas we already knew, they were already in Big Plan 2. This is a real opportunity to focus our attention. So for preparation for adulthood, we've approached each area for improvement on a quarterly basis so that we can be realistic about the progress we can make. And in the autumn term, we'd already identified the opportunity to review as work streams. So we knew, because we had, if you remember, we reported on this at Scrutiny last year, we had some help and support from the Regional Improvement for Special Educational Needs partnership through Disabled Children's Network and NDTI to help us improve. So very much this was an opportunity that we were actually underway with anyway. To refresh our preparation for adulthood work stream. There was some work that we have already started looking at information that's available for parents, carers, young people, and we've been starting to update some of those already. We do want to be able to look, and I've been having some discussions about the information that's available, guidance, and that actually some of that work started over a year ago, so we're building on that now and accelerating some of the doing. And just in terms of what Tom said about some of the annual reviews and how well they gear up to support youngsters as they move forwards from year 9 onwards, so looking at opportunities post-16, we do have an opportunity to work with our DFE advisor who's going to come and do a deep dive into our annual reviews, which will already complement the work that we are underway with. What we have been able to do, because we work really closely with the DFE and NHS England, we have got a further opportunity to work with the RISE partnership, and we're just working with them to put in place the activities between the winter and the spring term, and also because there are opportunities, there's been investment across the Yorkshire and Humber region, we have agreed to undertake a peer review, so that's where colleagues come from other local authorities to review some of the things that we're doing. They'll give us feedback on things that we do well, as well as giving us some opportunities, giving us some feedback so we can improve some of the things that we do. We've already been working with pathways sort of post-16, because it's not just about transition from statutory school age, it is about opportunities into volunteering, into the world of work, and we do have a good SEND employment forum, but actually there are opportunities now to scale that, and we've already been working with some of our post-16 providers as well as some employers about how we can improve those pathways and make those available to young people and their families. Once we've had the peer review, we will get a revisit with some of the, so that they can check in with us about some of the recommendations, and we will start to focus as well on gaps, any gaps that we have in terms of educational opportunities. We know that we've got some brilliant opportunities for youngsters as they move through into post-16 learning, but there's also some gaps as well, and it's how we work with the DFE and our partners to make sure that we've got greater opportunities for youngsters to move forward with their learning. So that's where we are just in terms of what we think is doable. How we will measure that, we can check. There's some measures that you can see there. We will look at the quality of our plans. We have to work together with our partners so we can think about making that transition as smooth as possible. That's not just into education, that is absolutely about where youngsters have support from health services and therapies. And it is about training some of our social workers, both in children and adults, to make sure we're getting really great contributions and in those plans. So I think that's the first area in terms of preparation for adulthood.
Thanks, Jo. And then we'll hand over to Stuart to take you through the waiting times plan.
Thanks, Tom. So as we said in the introduction, it's not uncommon. I think every area in the country will have some kind of action to do around their waiting times for health services for young children. So we weren't surprised to receive an action for this. So what we intend to do is not to rush into things and not to overpromise what we can't deliver, given the resources available to us both locally and nationally through the NHS and through other sources of funding. So that being said, there are some immediate actions that we have been able to take. So we were aware before the inspection that our wheelchair service was experiencing some delays and some children weren't receiving their equipment as quickly as they needed it to be. So a wheelchair service improvement plan was already underway, and some prioritisation activities taking place, and some additional funding has been identified and provided by the ICB. So we're on with how we use that money to get the children what they need to make sure that they have their health needs are supported and they're able to access their education and social activities. Over the summer, and then over winter, we're going to look at the funding and contractual arrangements to make sure that it's on a firmer footing going forward. There's some work going on across West Yorkshire footprint around access to neurodevelopmental assessment, and we'll make sure that we're working with our regional partners to implement that and maximise the opportunities to improve access there. We've mentioned availability of data earlier today, so we're going to work with our health provider partners to make sure that the data they provide is more accurate, timely, easy to understand, but also available to people who need to see it for the range of SEND services. As we move into the spring, we're going to look at begin to look at our CAMS services in speech and language. They've been prioritised as our areas that we want to improve first, as that's where we believe the most significant issues are and the biggest gains are to be had. So we're going to work with the service providers and they will lead the improvement programme, but we're going to make sure that we do it from a child and family perspective, so we understand what it is that's important to the child and family from these services and feed that into our improvement plans. It's also important to note that when we're talking about these clinical services, it's not just the clinical service itself that we need to focus on. There are a range of early intervention and support services that can reduce the need for those clinical services, and that if we get that right, we could ensure that the clinical services are used to their maximum efficiency. So parents have also told us that they need access to clear and easy to understand information about where they are in the queue, how long it's going to take them to receive their assessment or service, and also make sure that they've got as much information as we can provide about what they can do to help themselves whilst they are waiting. So by the summer, we'll do some more intensive work with children and families around their mental health to understand what they need to keep them well and what treatment they need when appropriate. We're going to look at, we talked about here about how we understand how well the service is helping people. So looking at what outcome measures we are asking the services to provide, so that's better than just a simple waiting time. It's how do we know that these services are making a difference to people as they use them. We'll continue our work over the summer to improve the wheelchair service. There's a couple of years left to run on the current contract, but there's a lot we can do within that contract to improve the service. But it's with an eye on the future to what it might look like going forward. And then moving into the autumn, then we'll give an opportunity to reflect on the activity that we've carried out so far. So the additional funding we put into the wheelchair service and the clinical prioritisation, how has that had an impact? Have people been able to get what they need? Have they been able to access the services and support that they need? And then that will be that time that we'll begin to look at new ways that we can implement our therapy services, and by that we're talking about speech and language, physiotherapy and occupational therapy, that helps to use expert staff in the best way. So we're looking at what we can do to help parents, school staff, and others, perhaps even other people such as people who work with care agencies or in the voluntary sector, how we can help them to use their skills better to improve the quality of life and outcomes for young people, whilst maximising that clinical resource.
Okay, thanks Stuart. So Jo will take you through the next area.
Thank you, Tom. So education, health and care plans. So this has been a really key focus for us anyway. I think we've spoken a lot about this at Scrutiny. We are really improving our timeliness. You know that we had a journey to walk, but we are much improved now in our timeliness for initial education, health and care plans. What we need now is to match that with our annual reviews. At the moment, for information, we maintain as a local area just under, and it's about 5,000 plans. It's just important now that we focus on that improvement for our annual reviews in a measured way. So already we're in the autumn term and we are prioritising the annual reviews for youngsters who are coming up for a change of phase. This is really important to make sure that we can get it right first time for them to move into their next phase, whether that be from the early years into full-time school, whether that's from primary to secondary, or youngsters that are moving to post-16, or actually moving into the world of work. So one of the things that we will be doing, we invested, as you know, in a new information and case file management system. One of the things that we are on with at the moment is to develop reports so that, as we can now with initial education, health and care plans, the annual review process can be tracked, and that we can be super clear about how we prioritise and make sure things are done in a timely way. We are undertaking some work at the moment. There's some work to listen to our schools about their experience of what it's like in terms of the annual review process. We're working with our SEND coordinators at Senko Network, but also as part of our cluster communities, and we'll continue to engage with the head teacher forums and some of our early years family hubs, both to share information but also to listen to feedback. The EHCP team can only coordinate that work if they are able to do that with partners. One of the things that we've always said, it's not just about timeliness, it is about quality. So the quality of what's in plans, we will continue to use our Envision 360 platform to review each section of the plan to make sure that it reflects children and young people and where they currently are, their needs, and that we work with our partners that provide advice to make sure that that reflects where those children and young people are in their journey. And we need to be able to do that in a timely way so that then the EHCP team can work with families to get those plans updated. And it is just really important. We're going to do some baseline surveying of our partner staff to make sure that we are clear about their confidence levels about their roles and responsibilities, which will then inform workforce development, how best we can target shared understanding and good practice. By winter, we should have a really detailed plan, and we have to be realistic about those annual reviews. We won't be able to get those all done all at the same time. We've got to balance that and be realistic, but be super clear with families about when they can expect their annual review, and share that information across the partnership so that we're all on the same page. Because we invested in our new case file management system, I think again we have been working on the functionality of that system. So there are some tools on those platforms that will help us to work really well with partners, but also perhaps most importantly, with our children and families. So by spring, we feel we will be in a position to make live the children and family portal, which will help families to be able to see where their initial education, health and care plan, but also their annual review documentation is, which will hopefully help with that co-production. That should also have that positive impact as well in terms of better communication, better ability to make amends and comments on plans. And we will revisit practice standards when it comes to EHC reviews, and we'll do that across the partnership, so we've got shared understanding, and we can feed back into practice progress events any learning that has come out of the auditing. And we'll then be able to see whether there's been an improvement, because we will take some feedback as a partnership to help us understand people's experience. Have they felt that's been positive? Have they felt that there's been an improvement? And then we'll review and we'll take feedback from our Parent Carer Forum, start to plan for the next stage. Thank you.
Thanks, Joe. And then I'll just take us through, conscious of time, so I'll just take us through the last slide, which is about communication and what we're doing about that. So I think, first of all, we're investing in some expert communication help to help us develop a really strong comms plan across partners as well as for parents as well, because obviously there's communication across the board. As you know, we'll build on the way we keep families and partners updated about events and progress against the plan. We're going to put that on the local offer and keep people updated about what we're doing. We're going to look at working with ISOS partnership about what works in SEND, in terms of having a workshop about learning from other local authorities who have really good communication. Even though we have really good input from children and young people, one thing we don't have is an established youth forum. So we're going to look at ways of setting that one up and hold the first one in the autumn to hear from children and young people about what they want. And also moving forward with that Liquid Logic portal in terms of professionals being able to look into it, if you like, at what stage the plan's at and check their input. That should really help in terms of consistency of communication. In winter we'll hold local offer live event, which we've done before, but it's a great opportunity for people to meet and share information and join workshops and meet other families. One of the things we're really wanting to do is PCAN do some training about day of a life of a carer. We want to take that on board as a senior team, and we also want our teams to take that on board, so we're getting a real understanding of how we can communicate better to lessen the impact of the multiple strains and stresses some of our parents have on their lives. Then in the summer, we're going to think about our Families Together Gateway and local offer, and look at whether we can have one gateway that looks at a number of information and videos and self-help aspects. We're going to review activity with our partners, including the DFE and NHS England. And then in the spring, we're going to have another youth forum. We're going to think very much again about that. Joe touched on it earlier, the last stage of the Liquid Logic portal, which allows parental access. And also we're going to have that action plan and lessons learned about communication. So again, quite a lot going on. And then just the last slide, Ed, is just really just to give you an update on the governance, which is self-explanatory really, but ultimately reporting to the Health and Wellbeing Board, Cabinet, but obviously you'll see Scrutiny on there as a key part of that. So just to finish off, I think it's worth saying on Monday we met with NHS England and the Department for Education to have a post-inspection meeting. NHS England and the DFE are very, very impressed with the way that we've responded post-inspection so far. I think it's fair to say, even though we got the middle outcome, they felt it was a strong outcome and they could see a real strength in the partnership. They're provisionally happy with the Big Plan 3, so we'll be looking to publish that either today after the meeting or next week, and we'll continue working on the detailed action plan, which again will bring back to Scrutiny for discussion moving forward. So I hope that's helpful. I know that's a lot of information all in one, but happy for any questions and comments.
Thank you. Can I just first of all say thank you to all members that have presented. I'm sure the panel will agree that it's a very detailed plan with some really robust outcomes that are being looked at, and it's great to see all those different partnership workings and how they come together. So it's been really useful from our perspective, and it like I say, it looks really focused and detailed. Just to be aware that as a panel, we are planning some visits, and I think Pecan is one of the visits that we're hoping to make, so that hopefully will then provide an opportunity to ask further sort of detailed questions and see firsthand some of the work and how it's been implemented. So before I ask anything else, over to the panel, I don't know if Councillor McKirk has got anything that you want to add.
I don't know, is it helpful to just do it in the 4 areas rather than a whole load of questions at once? So just looking at the first area for improvement, I wondered if you could just expand slightly on what the DFE advisor role is and how we access that support and what sort of things they're able to support with. The other thing I just wanted to raise was whether, when looking at that sort of preparation for adulthood, whether we're tying in with the Wellness Works pilot that's running at the moment by third sector leaders, which is looking at supporting people into not only employment but also volunteering. And it is open from 18, so I didn't know if that would be helpful to any of the kind of young people at that point. So.
Yeah, thank you, Councillor McKirk. We'll absolutely link in with Wellness Works. It's been really interesting what talking to partners about the inspection and the inspection outcome. We were at the Adult and Community Learner Awards and just happened to speak to somebody who's an employer in Kirklees. So we're folding them into sets. So it's helping us to have some different conversations. So all ideas are gratefully received and connections. So thank you. Yes, the role of the DFE advisor. So every local area has a DFE advisor. We've had ours and the NHS England advisor, and they've worked with us actually now for a number of years. So they work across the country, so they're able to bring some great ideas from other parts of the area, but they're also very experienced, so they provide support and challenge to us. They've worked, our DFE advisor has worked really closely with us for strategies and help and support to improve our 20-week compliance, but they're paid for roles by the DFE. And they're absolutely there to support people, partnerships to get ready for inspection, when they've had post-inspection, to help them with areas for improvement. But also where we have got amazing practice, which we have, and we shouldn't forget that, then we're asked to help shape things with others, both locally and nationally. For example, our DFE advisor been very, they've really liked the way in which we've developed our additional resource provision arm of our sufficiency strategy. And so several of our colleagues have been liaising with DFE policy writers to support guidance that is likely to come out in the not too distant future. So it's been incredibly helpful to us, and you know, helping us to take forward those improvements that were in our written statement of action, and they will come and they will meet with us, and it helps us to report back. So what we will want to do, every time we receive a visit, we'll want to be able to update people via the local offer so people can see the progress that we've made. Lots of support, but challenge as well, which is the right thing to do. And we're anticipating a white paper that the role of the DFE advisor as well will be to help us navigate the next steps and what that might mean. So it is really helpful to us as an area.
Thank you. Anything further, Councillor McKirk?
Yeah, I didn't know if anyone else had questions on that first one, otherwise I'll move on to the waiting times. Okay. A couple of things just about, so you mentioned the dashboard, Stuart, and I just wondered whether you said that was developing a new dashboard for partners. Is that going to integrate with things like the Liquid Logic setup that Send have? And, you know, are we thinking about trying to make it as kind of fluid as possible in terms of sharing that information? Do you want all the questions at once, or do you want me to just do one at a time?
I could answer that bit first, might make it easier. As always, integration is the aim, but we're working with what we have in a lot of cases and whether systems work together well or not. But the aim of this dashboard in particular is to really home in on what are the key metrics that we need to understand if we're making progress, and what are the things that are important to families. So we're looking for each service area to maybe just have only one or two things that we agree are the important things and that we are able to track. So it's just to bring those things together into one place, so that we can have one version of the truth, one set of data that we all agree on, and one that we can monitor our progress against the national trajectories is how we're defining it. So as long as we can get closer to the national trajectory of performance in those things, we'll be reasonably happy with that.
Thanks for that. Thank you for that, Stuart. What I would say, the really important thing around the dashboard is using the data that we've got, but bringing it into something that actually is meaningful for all of the partners and the professionals that are working together. But then the second aspect of that is then really simplifying that dashboard for our parents and carers as well, so they can actually visually see where we are up to. So you've heard in the presentation around where are our waiting lists, where are we up to with our EHCPs, etc. We want to be quite transparent about that with our dashboard, that actually we can then share that with people, so they actually, when we're talking about, you know, how long people are waiting for assessments, they can see the data on the dashboard to back that up as well.
Thank you. That actually answers the question that I was going to ask, so thank you for that. Have you got...
Am I right? Again, thank you. You talked, obviously, it sounds great, about getting the child perspective. I think it was in the spring you were talking about sort of bringing that in as much as possible. I just wondered how you were approaching that, what techniques you're using to get a range of views from different young people.
Yeah, it's still the fine detail of it's still to be determined, but that's our general approach really. We're wanting to work with as many people who these services might touch upon as we can. And to understand what's important for them. But there's a lot of work to do first in terms of kind of reviewing the services that we have and working with our providers to look at that more detailed action plan. So the detail of exactly how we're going to go about it isn't there yet, but that's the approach.
Thank you. One question which is coming in from some casework, but when we're looking at things like the waiting list for CAMS, something that was flagged to me was about a family basically being asked to select which of their child's issues was the most important, and that was the only one that CAMS were going to take forward, and if they wanted any of the other issues, they had to go back on the waiting list for them, even down to the level of choosing whether they wanted to deal with their separation anxiety versus generalised anxiety, and that felt to me like not taking an approach of looking at the whole child, and also possibly having a negative impact on waiting lists. If you have somebody who has got to the front of the waiting list, could CAMS look at trying to approach a sort of more holistic measure of support, rather than them then going back on and effectively becoming another statistic of somebody who's waiting a long time to get the support they need? That might be one just to take away. And then the only other thing was about the wheelchair service contract. You mentioned that is running for another couple of years, but obviously I know procurement processes start well in advance. Will the changes that you're looking at in the service have chance to sort of embed and you be aware of how effective they are before you're then trying to procure a contract for the new service?
Yeah, we built that into the programme of that time for kind of reflection and review. I think it's autumn next year, and that coincides with the time that we'd start to really work on the detailed specification for the new procurement. It's important to add that it's a combined Calderdale and Kirklees children's and adults wheelchair service, so we need to feed into that wider programme of what's important for children and make sure that they've got the priority they deserve.
I just noticed that Vicky has got her hand up to come in there.
Yeah, I was just going to come on to online. I think we've got Vicky.
Yeah, it was just in response to the wheelchair service. So what we do have the opportunity to do, as well as doing the immediate waiting list initiative with some short-term non-recurrent funding, is to look at what our opportunity is through the planning round, which is just starting, to make any in-year contract variations if we've got that opportunity and we've got some data, etc., to be able to do it. So we're not just waiting for this contract to end before we do any re-procurement or anything. If there are some key aspects that we can change and amend within the terms of the contract by enacting a contract variation, we will do, to make sure we're doing that progressive work as well.
To answer your question, thank you, Vicky. It's really useful. Have we got any further questions from panellists? I know we've got Councillor Smith online. Have you got anything? Or?
Am I right to move on to the third?
Okay.
Sorry. You can tell me to stop. I just want to, I think it's really good that when you're looking at the annual reviews, you are looking at like a triage system, effectively sort of prioritising those transition reviews and things. I think that's excellent, and I know that's something that parents have been asking about. I just wondered that if you have a young person who doesn't fall into one of those categories, and I appreciate that, and like you said about being realistic, I think that's really important. We're not going to pretend that suddenly we can do 5,000 annual reviews bang on time from where we are currently. But if they or the school feel that there isn't a problem, do they have an opportunity to sort of put themselves forward and say, actually, we do need this?
Thank you. That's a really good question. There's a real balance, isn't there? Some youngsters are really settled, and some of the feedback that I've had from, say, some Senkos or head teachers, you know, that's a relatively straightforward annual review. The youngsters settled, the level of fun, everything's going well. But then where things that maybe aren't going so well or the needs have changed, there is the opportunity to call an early annual review, and parents are able to do that. And I've got lots of engagement from parents and schools in that respect. And we are trying to be as responsive as we absolutely can be in that respect, particularly if there hasn't been an annual review undertaken substantially in the last couple of years. So absolutely, what we want to try and do as well is work with our schools, our settings, parents as well. Sometimes things might all come in at once. Is there a way in which we could perhaps balance that? So like I say, that detailed plan coming, but yes, I'd give some assurance that if things are not going where, you know, and there's some concerns, then that there is that ability to call that early review. Thank you.
Thank you. And my only other question on that was you mentioned about doing the satisfaction survey in the summer. So I just wondered if we got a baseline, have we already got the baseline data? Is that a survey that we've already shared with families?
So one of the things that we do as after every EHCP we issue, there is the opportunity for people to give us feedback, and I don't think it's unusual that quite often we don't hear the good stuff where people have been happy. We do, but you know, what we want to be able to do is absolutely, we did take some feedback when we were pulling together our quality assurance framework, so there is a little bit of a survey outcome there. But we want to be able to find a way in which, and some of that we'll be doing some work with our parents and carers. What's the best way? How can we do that in a really easy way? You don't want to have to fill out a massive survey. If there's a quick way that we can just capture some outcomes. So I think we just didn't want to make a promise we couldn't deliver upon. So absolutely we need to capture a baseline and then we'll be able to measure then whether that's improved.
That's fine. So it might even be that the summer is our baseline, and moving forward we've got that data to compare with.
Possibly. I think it fits, some of these sort of fit together, don't they? It fits across communication as well. We've got to make it easy to capture the information. So yeah, We'll take that on board, actually, just in terms of the when and what the baseline looks like.
And this is on the last section. So, Tom, it was just a question. I think that's great news that you're planning the youth forum. I think that's brilliant. I just wondered how you are inviting young people to get involved and how different ways that they can access of actually wanting to join it.
Yeah, we're doing a few things. So we'll work with Our Voice, which is our young people's involvement team, to look at the best ways of communicating with young people to do that. We've already got an established group of children and young people who we've been working with, but we want to widen that out. And the other thing, I've been having conversations with the Youth Council about how they strategically feed into our decision making as well. So we want to do it as widely as possible, you know, because obviously, you know, there's a number of children and young people in our schools who've got additional needs. Then we'll need to do some targeted things, I think, around specific development. So I think it'll be at all different levels. And the other thing that I should have said in there as well is that we're planning to have quarterly meetings with the established parents groups throughout the year, particularly because the white paper's coming up this year. So where possible, we're going to be meeting with, you know, PCAN, West Yorkshire, HDAD, the whole autism family. There's also a group of parents which I think we've met with Councillor McKirker, and we're going to meet with them to have discussions. And I think what's going to be really important through that period is looking at our improvements, looking at how that fits with the white paper, but how we're triangulating everything through that period. So, for example, this week, we've been in Schools Week. I don't know if anyone's seen it, but there was a big article about the cluster work, and Joe was interviewed about that and the positive impact that's had, and it showed all the other places nationally where it's been done. And that's obviously being considered as part of the white paper. Joe's actually been asked to go down to London to input into good practice around that. Again, these are the kind of things we need to let parents know. You know, we were talking about our statutory compliance earlier, weren't we? You know, our year-to-date statutory compliance is about 55%, which is above the national average. But if you look at it month on month, it's nearer 70%, which is well above. So lots of positive things to communicate to parents and children, as well as saying, how can we do things better? And I think the only way that we're going to improve the system, you know, it's widely acknowledged the system's not working for us, for children, families and for parents, is to do it together. So we really want to have some of that more formalised, you know, engagement and co-production across Kirklees.
Thank you, and that sounds really positive. And I know you've got a very engaged group already, but I think it's really good that you're going to be reaching out elsewhere as well, because there are sometimes the voices who maybe have the insight we need are the ones who aren't engaged currently. So that's great, thank you. And I'll stop.
Thank you, Councillor McKirker, and thank you to all members of the group for your presentations. And Tom, I think you summarised that really well with your closing remarks about that engagement, because I think that is the key to success, is engaging with everybody and making sure everybody's voice is heard. So as a panel, we'll be really interested to hear of progress, and in particular with the Youth Forum and what Joe mentioned about the day in the life of the carer. So some of that work we'll be following really closely with interest. Yep, with PCAN Group. So look forward to that. So thank you. And on that note, we'll move on to item number 8, which is the performance data and a verbal update on the highlights. So, thank you, Tom. Thank you. So I'll hand over to Joe and Robert for this item.
Yep, straight in. So the first question is around the proportion of up-to-date under-5s developmental assessments and how it's dropped and whether it would be reversed or not. So I just wanted to sort of set out that we think this is a data issue rather than a natural lack of health assessments that are taking place. So the data we receive from Locala reports a much higher figure, showing that 97% of children looked after have had their under-5 developmental assessments in Q2, so that's July, August and September. And all of the looked after children who are under 5 and placed out of area were also completed. So we've established a care experienced health data group which involves social care and Locala, and our data team, and we're going to try and work out what's accounted for this gap in the data, but we think it is essentially a data recording issue. And one of the things we need to make sure our social workers are doing is ticking the right box on our liquid logic recording system to show that these health checks assessments have taken place.
Thank you.
Sorry. Do you want me to go straight on? Next question was about dental assessments. And the measures we're taking place to track the effectiveness. So the Care Experience Data Group will review the dental assessments at the last quarterly meeting. And we think what it is, it's the figures are coming from a lack of opportunities to get updates from carers and reminders to get a dental health check done in the first place. So what we think is that the carers are being asked infrequently about whether a health check has taken place. And so we need to get better at making sure we are asking those questions in available meetings. And sometimes the data isn't being put into our liquid logic system to say when a check has taken place. So what we're asking is that our heads of service oversee this process now to make sure that all the data is input when it has taken place, but equally the questions are being asked in the right meetings to make sure carers are undertaking the checks. Third question was about figures for adoption falling. And the question is this due to the insufficient families coming forward to adopt, or that those are being found not suitable? What else can be done to encourage adoption? So I just want to set out, first of all, that adoption is one option available to children at the end of care proceedings. And it's not that we encourage or disencourage adoption, it's just we need to make sure it's the right option for that child at the time. Nationally, there is a reduction in the number of children being adopted, so it's not a Kirklees specific issue. So in 2020, 3,440 adoptions took place nationally, but in 2024 it was 2,980. So we do consider all other options before adoption is agreed. So that includes looking at family members that are available to care for children. And we see we've got an increasing number of children that are subject to special guardianship orders at the end of proceedings. That means they're staying with families rather than stranger carers. And we see this as being a strength of our approach. We also have our New Beginnings model where we work with families as part of the pre-birth process. And that is seeing increasing children staying with their families rather than going through the care process. So we see this as an indicator of success. However, if children do need to be adopted, obviously we do need to make sure there are sufficient appropriate carers for them. When we work with One Adoption West Yorkshire to help achieve this.
Shall I just touch a little bit? I mean, we did in the previous item, but we're looking at the moment at August data. Some headlines, so like Tom said, our cumulative figure for initial education, health and care plans being undertaken within 20 weeks currently stands at 54.4%, just under 55%. And if we compare that to the national average, which was published for last year, that stood at 45.9%. So we are in a really promising position. I think it's interesting because it's August data. It's over the summer period, and we've got to recognise that a lot of schools and settings are not in session. Makes it just that little bit more difficult, but I'm really proud of the EHCP team, of our partners, but also our schools who did go over and above in terms of responding to consultations, which has undoubtedly helped us to keep on that improving picture. We will have to keep an overview on timeliness, because what we did have in June and July was a significantly higher number of requests than in the previous quarter. So in June there was 125 requests for assessment, 137 in July, and if you compare that in August there were 33. There's definitely an impact of schools not being in session, but one of the things that we're also undertaking a little bit of analysis upon is where the requests to assessments are coming from. We're seeing an increasing trend input, and that's absolutely fine. From parents and carers, and we're seeing that nationally as well. So it's just one to keep an overview upon. And we will, I think, as we said previously, we are undertaking a fair bit of work at the moment now. We've got that robust data dashboard for EHCPs, so we can give some more detail around progress on annual reviews. I think the other one, it does actually again play into the action plan, for post-inspection action plan. At the moment, some of the health information we can provide to our partners on a quarterly basis. We need to obviously, and we want to improve that. So at the moment, you've not had any data for August and it's more of a timing thing because it's a manual process at the moment. But I think those are my highlights. Chair, back to you, Rob.
Thank you. So the last question there was about the jump in the number of exploitation risk assessments in August, and the question was whether are they related. So there has been a jump in August, but they're not related to any specific incident. What we notice, the numbers do fluctuate from month to month, but often numbers go up after we revisit training or review our practice. And we do know that in June and July, we revised our definition in order to help the exploitation screening panel employ greater consistency together with training to embed the revised definitions. So that could account for that increase. The rise in demand for exploitation assessments does correlate to the number that are overdue, unfortunately, but we do have weekly checks to make sure we monitor and support the completion of those assessments. And all cases that are reviewed in exploitation screening panel as well, which does give a greater level of assurance as well.
Thank you, Robert and Joe, for comprehensively answering the questions that the panel have put. Any comments or questions? Councillor McKirkle.
It's only a quick one. Jay, just following up on, obviously you've pointed out that very high rate of plan submissions in June and July. Do you feel as though there is capacity in the system to still maintain these? I mean, the compliance rates now for that 20-week deadline are amazing, and I think kudos to your team for sort of the work they've put in. Do you have concerns about this bulge of plans that were submitted in June and July having an impact on the compliance rates, or do we have capacity within the system to sort of manage the assessments that will be needed?
Thank you. That's a really good question, and I think it is absolutely. We've got to keep it under review. It's the coordination of the HCP team, but it's also all the people that those that are going for a decision to assess, whether it's educational psychology, whether it's our therapy services. There is pressure. So one of the things that we will continue to engage. One of the things that has helped us with that success is that shared understanding across the partnership. One of the things we're keen to do as well is how can we work better or different with our system. So, for example, we did put a little bit of challenge to some of our Senkos. Why everything coming in right at the very end of term? Is there something we can do to develop with our clusters? So I think it's going to be a challenge, Councillor McKirkle, but one that we know, so we can try and plan and have that shared understanding, but it may impact next quarter's timeliness.
Thank you for that. So if there's no further comments, nothing online, thank you for the presentation there. We'll move on to agenda item number 9, which is pre-decision of scrutiny. So I know we've got Cabinet Member Councillor Riley with us. Is there anything that we... Sorry, I said we've got Councillor Riley with us. So is there anything on the horizon that the panel needs to be aware of? So yourself and Councillor Kendrick online. I don't know if there's any feedback.
Okay. I wouldn't really call it on the horizon, but I was just going to reiterate some of the things that we had been talking about in terms of Cabinet priorities, such as making sure that we secure sufficient learning places, and priority would be for the SEND pupils. We've obviously got the new schools that are being rebuilt, Joseph Norton Academy and Woodley School and College. Post-16, then there's work that we're going to be doing, and this will hopefully increase opportunities for post-16 young people. We've been talking about the cluster working within the schools and continuing to embed and develop that greater support. EHCPs, we've been talking about improving the quality and the timeliness of the annual reviews. And then we've got the white paper, which will be coming out. It may be winter rather than autumn, I'm not sure, but will be obviously, that will obviously be a priority then as well. Thank you.
Thank you for that update, Councillor Ryler. I don't know if Councillor Kendrick's got anything to add, or any of the officers of anything up and coming that we need to be aware of, or the panel need updated.
I think Councillor Ryler has covered most things.
Thank you, Councillor Kendrick. So if there's nothing further on that, item number 10, which is feedback from panel members on issues considered by the Kirklees Parenting Board. So Councillor Kendrick, have you got anything that you want to add from the last meeting?
Yes, to some extent. I mean, at the last meeting, we looked at the fostering strategy. And one of the things that came out, we have some really good input from our young people who come to Parenting Board. And one of the things that was raised yet again was about the lack of reciprocal arrangements where care leavers are placed are living in other areas other than Kirklees. They can't take necessarily advantage of the things that are provided for care leavers living within Kirklees. And Tom Brailsford and I both took to take that forward to the different groups that we go to in Yorkshire and Humber. I know Tom raised that at the directors' meeting yesterday. I was at the Yorkshire and Humber Lead members meeting where I made that proposal, and there was a huge appetite across all the authorities who were attending. And we're going to go away and first of all look at what we do offer in particular. Say, for instance, in Kirklees, we offer passes to our sports and leisure centres for our care leavers. We're each going to go away and look at that and look at what we can start to develop across Yorkshire and Humber. And I suppose the only other thing to mention about Parenting Board is we are looking to have the next meeting as a takeover meeting by young people. We've done this before, and we are looking at late November with a later start time to enable more young people to be participants. I think, unless anybody else has got anything else, I think that's some of the key bits from the last meeting.
Thank you, Councillor Kendrick. That's really useful. We've got Councillor Smith has got his hand up.
Thanks. Just on that point that Councillor Kendrick made about outside of Kirklees, the obvious things that spring to mind are, well, obviously we could try and find a way of keeping people in Kirklees, but the other one would be a reciprocal arrangement with local councils. I don't know whether these people are moving to places a long way away or if they're moving just outside Kirklees, but if it was Wakefield or Bradford or Leeds, etc., then we could perhaps look at having a reciprocal arrangement where people from their authorities moving this way and our young people moving into their areas maybe treated as if they were, you know, originated in the same council area. I don't know whether that might be something that would work. Not sure about making meetings start early. Just I think we should be encouraging to get out of bed, but that's an aside. Cheers.
Yeah, can I say about the lateness of the meeting is to enable those young people who are at college, school, working to be able to be participants. You know, they couldn't be at this meeting this morning if they're in any of those arrangements. As for reciprocal arrangements, I mean, one of the councillors who was there, and I can't remember from which authority, I think one of the South Yorkshire authorities, was saying, well, what about prioritising? We all give priority to care leavers for rehousing, you know, and if a young person has been placed in Barnsley, for instance, and has grown up there, and that's where their links and networks are, that's where they're going to want to probably live. Whether that's a feasible one or not, I don't know, but we're going to explore. And the other thing is South Yorkshire have free bus passes for their care leavers, and that is something those of us in West Yorkshire are raising with the Mayor for West Yorkshire, because we would like the same here, and we'd like to be able to provide that for young people who are placed within Kirklees from other authorities. We do offer what we can in Kirklees, in that our drop-in centres are available for young people who are placed from other authorities, and things like the Christmas Day dinner and an event. Any young person who is on their own, who is in Kirklees, is absolutely welcome to that, and to other celebrations that we have, Eid celebrations and so on.
Thank you, Councillor Kendrick. Any further comments, questions? No? No, thank you for that. So which takes us on to the last item, which is a work programme and agenda plan. I take it that you've all got a copy of that. I think it's up to date. Have you got anything you want to add to that? No, so yeah, any comments on that?
Not only just, I know you mentioned we still not have a date for the white paper, so we can't specifically kind of factor in when we need to be looking at that.
Yeah, there's no date for the white paper. I think the latest date they've said is mid-November. Now, whether that happens mid-November or not is to be seen. So yeah, so I think what we probably need to do is be a bit flexible about that, don't we? So when the white paper comes out, I think we probably need to do a policy digestion of it. You know, what our response would be, but bring it here for kind of discussion.
Yeah, no, I think that's on the plan. But yeah, good flag, Hannah. So that's it, guys. So I just want to thank you for your attendance and for your participation, and I draw the meeting to a close. It's 11:45. Thank you.